The broadcast is now starting. All attendees are in listen-only mode.
Happy New Year and good afternoon, everyone. Today is Wednesday, January 6th. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the Maryland Community of Practice for Supporting Families webinar series. This is webinar number 16, Electronic Visit Verification, EVV, Check-In. This session is being facilitated by Mary Ann Kane-Breschi, Director of Family Supports for DDA. And today's guests include Nick Burton, Central Region Director with DDA, Vanessa Finc, Maryland Department of Health, Health Policy Analyst in the Office of Health Services, Policy and Compliance. We also have Beth from Creative Options as VP and Chief Operating Officer. And we also have Alice Adger from Creative Options as a direct support professional. And before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options for listening to the webinar, by computer and phone. And if you have trouble hearing, you can try switching modes by clicking on the appropriate button on the webinar panel. There is one handout for you today in this webinar, and you can find it in the handout section in the panel to your right. It can also be emailed if you are listening by phone. We will be recording the webinar and posting it on the DDA website. We will be taking questions related to the webinar at the end of the presentation, and if you have a question, please submit it through the chat or question box on your screen. In addition, we're interested in highlighting how people with disabilities and their families are supporting and caring for one another during this pandemic throughout the webinar series. If you're interested in sharing your story, please contact Mary Ann Kane-Breschi directly at mary.kane-breschi@maryland.gov or me, donna.will@maryland.gov. And now I'd like to introduce Mary Ann Kane-Breschi. Good afternoon.
Good afternoon, Donna. Thank you. Good afternoon, everyone. On behalf of the Maryland Community of Practice for Supporting Families, Happy New Year and welcome to our webinar. The purpose of this series for supporting families is to bring people with intellectual and developmental disabilities and their families, however defined, along with others, to connect, share information and ideas, and learn from one another. We do this in an effort to support each other and build resiliency within ourselves and the community as we find our way through COVID-19 and our lives. Throughout the series, we've discussed and have addressed, and will continue to do so throughout the year, a variety of topics and concerns with which individuals and families are facing. And of course, we do this through the lens of charting the life course framework and the help of invited guests and subject matter experts. Today, our focus is on electronic visit verification, otherwise known as EVV. As you know, DDA rolled out EVV in the Eastern and Western regions in October of last year, in the Southern region in November, and Central in December, bringing DDA in compliance with the Cures Act deadline, which was January 1st, 2021. Happy to report that EVV is up and running successfully in each region. That said, there have been some challenges, as you would expect, and questions as well. So today, we'd like to hear from you, people receiving services and families, about any challenges and or questions you might have so we can address them. To help us do this, we have a wonderful panel made up of, unfortunately, we have a family member who's not able to be here today after all, but that's okay. We have direct support professionals and other professionals alike to help to address and hopefully answer any question you might have. What I'd like to do is I'm going to ask each of our panelists to introduce themselves, and followed by a brief review of EVV, and then we're going to get into the questions. So it's going to be a brief presentation. Panelists, I want to welcome you and thank you for your time, expertise, and sharing your experience with us today. Can you please tell the audience a little bit about yourself, your role, and your experience with EVV? And I'd like to begin with Nicholas Burton, please. Nick?
Hi, thanks, Marianne. My name is Nick Burton, and I'm the Central Region Director for the DDA. My experience with EVV has really been working with the providers and the CCS agencies in really effectively rolling out EVV by ensuring the personal support PCPs were reviewed and approved and got into LTSS by the deadline within the region. And we had a pretty good success rate with that. And it required a lot of collaboration amongst providers and CCSs. So I'm happy with where we landed on that in terms of meeting the deadline.
Terrific. Thank you, Nick. How about Vanessa? Would you go next, please? You might be muted, Vanessa.
Sorry, yes, no, I was, and then I was a little click happy there. Okay.
Don't worry.
So, my name is Vanessa Finc. I work with Maryland Department of Health and Medicaid Provider Services, specifically in the ISAS division, and we are the ones who developed the EVV system along with our vendors. I have worked with what is now a provider portal for a little over 6 years. I mainly work with agency providers. I lead a lot of the trainings for them, and I also work with any issues they might have and helping to resolve those issues. I did participate in some of the DDA provider training through the last round, and so happy to be here today.
Thank you, Vanessa, and welcome. Beth, how about you, please?
Sure. Thank you for having me here. My name is Beth Eby. I'm the Vice President and Chief Operating Officer for Creative Options. We are a provider agency in the Central Region. So we began using EVV December 1st. I oversee the day-to-day operations of all of the departments at Creative Options, but specifically overseeing personal support services and supported living. And alongside with our fiscal department and our case managers, we've been working closely with the people we support and their family members to roll out EVV within the last month.
Some wonderful. Welcome. And then finally, Alice.
Hi, I'm Alice, and I'm so sorry you guys can't see me. I think it may be my antique phone, but I'll try to do better the next time and be maybe on a tablet or something. But my name is Alice Adger, and I work for Creative Options. I do home care, direct care in the individual's home. I enjoy doing it because it's hands-on, and I get a chance to be more hands-on with the individuals, to actually see the smile, hear some of the things that the challenges, and just being there in person, you actually experience it more than if you're doing paperwork. I mean, that's just for me. That's just the type of person that I am. And I've been doing it now with Creative Options for a few years, but I've been in this field for almost 9 years. So I actually enjoy doing this. So thank you.
Wonderful, Alice. Thank you for being with us today. Okay, with that, Vanessa, let's move on to a quick review of EVV. And then once we get through this, we will take questions. Please go ahead.
Okay, great. So let's start with what is EVV. So EVV stands for Electronic Visit Verification, and that refers to technology that electronically verifies that services are delivered at the right time, to the right place, and to the right person. And it is required for both provider and self-directed services. ISAS, which I refer to, I'm in that division. It also refers to a system, the In-Home Supports Assurance System, and that is how the state of Maryland is implementing EVV. It's a phone-based electronic billing system that has been in use for several years, and now we have modified and rolled it out for DDA. Direct support professionals will check in at the start of the service and check out at the end of the service using the person's telephone or the one-time passcode device, the OTP device. And as Mary Ann mentioned, this is in response to the 21st Century Cures Act. Federal law requires that Maryland use EVV to verify 6 factors for personal support services. And those factors are the type of service performed, the person receiving the service, date of the service, location of the service, individual providing the service, and the time the service begins and ends. And CMS has approved MDH's good faith effort exemption request, extending the EVV implementation deadline to January 2021. So some of the options for EVV, personal support services can be delivered in the home, in the community, both in the home and the community, and also virtually. Now, virtual services have to be recorded through manual entry. The agency provider will have to enter those manually. And then it can be recorded, services can be recorded with the participant's phone if the phone number is registered in LTSS Maryland. So that's something that would need to be done ahead of time. With the OTP device, with any phone. So sometimes OTPs are referred to as a device or a token or a fob. Mainly we refer to it as OTP device. And then through manual entry, which I mentioned, where the provider agency will submit the time after the service is performed manually.
Great. Thank you, Vanessa. I promised you all it would be a very short presentation. Here is a picture of the OTP device, with which most of you are familiar. So with that, thank you, Vanessa, for that quick review. We're going to get right to the questions and have a discussion if you'd like. We're fortunate to have Patricia Sestoki with us today, Director of Programs at DDA. She has been monitoring the questions and she will read them to our panelists and then they will respond. Patricia?
Hi, thank you, Marianne. Appreciate that. So we have a couple of questions here, but then we also have some questions about EVV for self-direction. I know Vanessa talked about that EVV applies to personal supports and people in self-direction. We are not implementing EVV for people in self-direction at the present time. We are waiting to work with our new FMS in a contract, and at that point we will roll that out. So we will be giving further guidance and instructions to participants in self-directions about EVV implementation in the future. At the present time, we are not implementing EVV for people in self-directions. So hopefully that clarifies that. So I'm going to read this question. My daughter receives services through CFC and will begin to receive personal supports through DDA shortly. She has an OTP device through CFC. Will she get one through DDA too? Vanessa, do you want to answer that? You're on mute.
For some reason, there's a big delay from when I click it. So no, there will be the same OTP device. The DDA, the DSP will dial in using a different number to clock in for EVV than the CFC aid. Excuse me, however, they'll have the same device.
Great, thank you. So this one says, my daughter was in a day program pre-COVID and I'm being paid to be her caregiver for both CFC and DDA. If she participates in a Zoom from day program provider, can I get paid for her caregiver? So this is specifically for personal support. If you're providing meaningful day, that is not personal supports, but if you're providing personal supports, then yes, you'll be able to bill for that. And Beth, I see you had shaken. Do you want to add to that?
Okay, so if I understand the question correctly, the question is, can someone get day support services virtually or in person?
Yes, and they're saying that their daughter is in a day program pre-COVID and now being paid to be her caregiver for both CFC and DDA. If she participates in a Zoom from the day program provider, can I get paid for the caregiver services? So that's very different than the EVV and personal support. So I want to make sure that that's real clear. So the answer is yes, you can get paid, but not through EVV or through the token, because that's for personal supports only. If you're providing meaningful day virtual supports through that, then you can bill through that service. And Nick, unless you wanted to add to that as well. Okay, all right, thank you.
I think you captured that.
Great, so I have a question. If my son is receiving personal supports virtually, does his staff need to use the OTP to clock in and out?
The provider agency will have to enter virtual services manually, because the OTP must always stay with the participant, with the client. So it can't leave the client. So if they're not with the client and they're providing some service, this would have to be entered manually.
Okay. And then the person here clarified the previous questions. This is for personal supports, not meaningful day. So anything on personal supports, you have to bill through the EVV process. Okay, here's another question. It is difficult or time consuming for you as a provider to correct any errors, clock in and clock out. Should they happen?
I think I can answer that question. We have quite a lot of experience with that as a provider agency. So yes, so in the beginning stages of implementing EVV, we have experienced a lot of errors, but we're learning as we go. Because this is new for us as a provider and new for our employees. Yes, there should be a system in place for people providing personal supports to log any kind of errors if they forgot to clock in or forgot to log out. We have a system in place for our agency and how to accomplish that. And so there should be a minimal number of errors after a certain period of time. And that, I think there's an expectation that we have this learning curve at the beginning, but that at a certain point, and Vanessa, maybe you could speak to the errors and how they might accumulate points for a specific employee, but at a certain point, we're expecting that this will become routine. Now it is a new process. We have our employees who have to clock in and out through our payroll system, and then they have to do the same thing through EVV. So it's that two-step process, and they're just getting used to following that routine. And yes, in the very beginning, there have been some examples, a number of examples where people say, oh, I forgot, or, what have you. But as we get further along in the process of implementing EVV, we're expecting that the number of those errors will be greatly reduced.
Right, thank you.
Is it
Beth?
possible that I could piggyback on that, Beth, or you guys?
Absolutely.
Or
Absolutely.
Okay.
Absolutely.
I have a question. If you're talking about the point system, and as far as errors, what happens when you have an individual, you are doing what you're supposed to, you're clocking on the paychecks, and then you get to the house, at the house, you're also using the EVV system, but this person is not coming up. Like, you dial the number, it takes the MA number, but then when you put in your social security number, it tells you that your social security number is incorrect. But I'm doing it with all my other individuals and it's working fine. But this one person, and it's been like that since the beginning, I don't want it to look like I'm not using the system. I am doing it every day more, and I still do it, even though it says it each for in and out, I still will do it, because I'm thinking maybe you all will see that at least I called in on the line or something.
So you're doing the right thing by continuing to attempt.
Okay.
The main thing is, if you're running into an issue like that, is to let your agency know so that they can let us know that there's some type of issue and that we can have our technical team look into it. Because especially in the circumstance you're saying where it's only a problem here, not other, we're going to want to look into that and try to figure out what's going on so that we can get it corrected. But in general, for points, you are only assessed points if it's something out of your control.
Okay.
So if it's a technical issue, you wouldn't be assessed points for that as long as we can verify the technical issue.
Okay.
And I do want to say, by you attempting each time, even though you're having an issue, you are doing the right thing. Sometimes we have people, give up. They say, "Oh, this is not working," and that is problematic because we have no proof then that you were attempting to clock in. So we can see that you dialed and you attempted, and that's to your benefit.
Well, I'm glad that I'm doing that part. And I have notified Tiffany, Beth, about this, so I don't know what's going on with it, but hopefully they'll get it straight. But I'll continue, and anything I need to do, I guess you guys will reach out to me. They'll let me know, but I will continue to do. So I'm glad I asked that question. Thank you, guys.
Yeah, that was a great question. Yeah, and thank you, Vanessa, for answering it so thoroughly. And yes, Alice is an example of a very diligent DSP. We are working with us, and because you've been so diligent, Alice, you've been making Tiffany, the case manager that she works with, and your case manager has made me aware. So even though you and I haven't even spoken directly, I'm well aware of the concern.
Okay.
So, and we're going to seek some answers as to why that might be happening.
Okay, thank you.
Absolutely, thank you.
All right, so there's Beth, you want to share any other challenges that your staff have had in implementing the EDD?
Right, so some other challenges that we've had, and I think that this was partly mentioned earlier, if the person is receiving CFC hours as well as DDA hours, and staff knowing the difference between the hours that are allotted for each. So we've had a situation where the person is receiving part of the day they have CFC and part of the day they have DDA, and the staff just clocked in for DDA hours the entire day, and that ate up a lot of the person's hours for the month, which caused a concern. So there's been so the team had to come together and try and figure out a way to make sure the person still receives services that are needed. But that has been a challenge. Just getting the information out to everyone. We held several all staff meetings. We invited all stakeholders to those meetings as well to make sure that everyone was understanding about the process. The other challenge is really as an agency, and trying to make sure that our families and the people that we support are aware that this is so new and that we've had to actually put some additional processes and procedures in place, because as we go through, we're learning, okay, we need a way to log this information, and we need a way to understand how to make the communication flow between fiscal and the case managers. Just basically just making sure that we're in communication frequently with all of the stakeholders, all of the people we support, the direct support staff. That has been initially been a big push and a challenge from the beginning. But I think that we're on our way. Having said all of those challenges, I don't think that we're at a place where, we're moving backwards. I think we are moving forward with the process, and just like anything else that's new, you have to learn from your experiences and put things into place and continue to move forward.
So Beth, what happens if a person in services forgets their key fob when they meet a DSP in the community?
So that, from my understanding, what we're doing is a manual entry for that. So we have a system for the direct support staff to communicate with their case managers. And then we're using Teams a lot at Creative Options in order to collect information in a central location. So yes, there's a system in place for people who don't, if they don't have the OTP device, or they have other errors that need to be recorded in order to make that correction.
Okay, and so what happens if the person forgets the EVV device, can they still get services?
Yes, yeah. So we aren't stopping services because we don't have the OTP device. Of course, the staff are there and they're going to provide the service, and then we'll make the correction after the fact.
And do family members who are paid staff have to use the EVV?
Yes. Yeah, so all direct support staff providing services, whether they're family members that are working under Appendix K, or if they're, direct employees of Creative Options, they are using the EVV device, or following the EVV system for logging their hours, I should say.
Okay, great. Now I have a couple more things here on the chat. And this is for DDA, so Nick or either Marianne. What can the provider do if the personal supports have not been approved in LTSS by DDA, but the service was requested as an emergency and the agency is providing the services and getting errors in LTSS? How do we correct this issue?
So services obviously need to be authorized through the PCP and approved by the region prior to them being provided. If there's emergency need for service, we've given direction in our guidance that that needs to still go through the region, and you can send an email to the deputy or the regional director documenting the need, and approval can be given at that point, but then it does need to be followed up with a PCP revision ASAP so that we can get that into LTSS so that the provider can bill.
Thank you. What if a DSP cell number is connected to a client we don't support and I have to manually enter her clock in, clock out, and it causes errors, overlapping? Vanessa, do you have a response for that?
So the main thing with that is to make sure that you're communicating with the CCS to get that corrected. That needs to be, you can also email us and we can correct that because it might not be under the same CCS. So you can email us so that we can get that number taken off. That does cause a lot of problems, but it is something that happens, and we understand that it happens. So you just need to let us know. So the agency, as a provider, you just need to email and let us know what is going on, and we can work to correct that. So if it created an overlap, we can take care of that. Or a lot of times what we see is that the agency will just let us know that this has happened, and sometimes we can fix it on our end too. We would have to re-enter it on our end. But either way, we'll make sure that it gets fixed so that you all get your pay.
And this may be a little similar to that, but I'm going to still read it just to be sure.
Sure.
As an agency, how do we solve the issues of overages of hours for the month? Do we disregard the services, or is there some way we override the overages?
Well, it should cut it, the hours. I'm trying to think if DDA is different.
I can chime in, Vanessa.
Go ahead, Joey.
So for everybody's reference, I'm Joey. I'm one of the managers with the ISS team. So on the DDA side, what you will see if a provider goes over their PCP hours for the month, you'll see an exception in the provider portal. And so that exception will say, I don't remember the exact verbiage, but it'll essentially tell you that you're over your approved hours. And so the resolution for that would be to reduce the hours to be within the PCP so that service can go through to generate a claim. And if you believe that the problem is due to a PCP and maybe the hours are incorrect or something, then that's something you'd have to work with the regional offices and CCSs with.
Right. Nick, do you want to add to that about the next steps if they need to update their PCP? Nick?
Yep, sorry, I was trying to unmute. The next steps in terms of updating their PCP. So if you need to update your PCP or you need to do a PCP revision to ensure that the services authorized meet your needs, you need to work with your CCS to complete that PCP revision and submit it to the regional office so that it can be reviewed and approved before that service is authorized. Again, if it's an emergent need, then your CCS should reach out to the regional director or the deputy regional director to get email approval, and then they need to submit a PCP revision to reflect the need.
Thank you, Nick. And this may be for Vanessa or Joey, but redeterminations are delayed in LTSS. Will services be paid when LTSS is updated? We're putting in manual services until this is corrected.
Can you repeat that?
Redeterminations are delayed in LTSS. Will services be paid when LTSS is updated? We're putting in manual services until this is corrected.
I'm not sure I'm understanding. Joey, did you understand that?
Hopefully this answers the question. But if there's as long as there's a PCP that covers the dates that you would be billing for, when the enrollment is corrected, and as long as the eligibility is there, then yes, the services that were recorded should pay. But until that happens, they would end with an exception. So you would see that in the system.
Yes, Joey, that does answer that. Thank you. And this is another one. Just for clarification, all DSP should be able to clock in and out whether the OTP is there or not, correct?
Well, if the OTP is required, then if the OTP is not there, they're not going to be able to. But to answer it a different way, everyone is not assigned an OTP device. Maybe that's the better way to answer it. So everyone doesn't have one. So if one is assigned, then they would need the OTP device to clock in and out. If it is not assigned, then they would use whatever phone number is designated for them to use. So if it's the cell phone or the home phone, or maybe they both are assigned, then they would use that. I hope that answers that.
Yeah, so let's drill down a little bit for the audience. What do you mean when you say it's been assigned? How does it work?
So, okay, so like I said, OTP devices are only assigned as needed. So if there isn't for example, if there isn't a phone available, or perhaps they only have a cell phone and poor reception, or perhaps they have a cell phone and they have limited minutes that they don't want the DSP to use it. There are various reasons. But anyway, once the decision is made by the CCS that an OTP device is needed, there's a serial number on the back of the OTP device that the CCS enters into the system, and that specific OTP device is assigned to the client. So we know if the system is looking for that specific device. So when you put the code in, it marries it up to the client. Excuse me. So once it's assigned, you can't clock in without it, right? So I know some people, for example, had some issues because in the beginning, if they are receiving, for example, CFC services and DDA services, and one program assigned an OTP device, then they were having trouble clocking in without it, without using it.
So let's go back to that.
You know what? Let me actually, I'm sorry. I think I am telling you something wrong. Something is different with DDA. Joey, DDA they can use without it. Is that correct?
Yes.
Yes.
Joey, are you there?
Yes, I'm here.
I'm sorry. DDA, they can use the OTP, not use the OTP. They can clock in without it, correct? I'm sorry, my voice is going.
So if the OTP is assigned, I believe if you don't have it, it would ask you to enter the MA number.
That's correct, yes.
Yes. So you'd be able to navigate through the prompts that way.
I'm switching through between programs, so I apologize for that. So with CFC they can't, but with DDA you can. So there is an alternate way to clock in. So yes, sorry about that.
Yeah, we wanted to make sure there was flexibility for our population, and
Yes.
You guys did granted that, so I do appreciate it. I also do want to make sure, Vanessa said that the CCS assign who uses an OTP, it is determined by the team based on the person and based on their skills, their abilities, and the level of support that they need. That's what we have, the two options where people can use an OTP and not use an OTP device for that flexibility. So we wanted to share that.
Thank you.
Mary Ann, there's a lot of questions in the chat, but they really don't have anything to do with EVV. They're about Appendix K, about LTSS. So I'm going to move some of those questions for the Friday presentation with Bernie, because we are going to talk about the Appendix K. We are going to talk about LTSS. But Nick, I did have one for you. What if LTSS does not reflect the correct number of hours or units? The correct units are in PCIS2 as a revision, but not in LTSS. The individual is now over-authorized units in LTSS. Does the CCS need to correct this? And maybe you can talk a little bit about how we work into two systems and how personal support is in LTSS and what should that look like. So can you walk us like step by step, baby steps to get people understand, what does it mean to move from personal support in PCIS2 to personal support in LTSS to reflect what people should be billing?
Yeah. So essentially, we are operating in two billing systems within the DDA. We have LTSS and we have PCIS2. As you all know, LTSS is where the PCP is developed. It's developed in LTSS by your CCS in collaboration with the person and their team. As of 12/1, all personal supports within DDA are authorized and billed through LTSS and no longer in PCIS2. However, there may be some services that are authorized that are still billed through PCIS2. And so it's important to remember that PCIS2 and LTSS are two different systems, and that there isn't always necessarily a one-to-one match in terms of how the services look when they're authorized in each system. But the most important thing to ensure is that the PCP authorizes the services, and those services reflect the need of the individual based on the services that are chosen. And so if somebody has personal support services authorized and it's documented in LTSS, and those personal supports are not meeting the person's needs, the person needs to discuss that with their CCS and their PCP team to talk about what services or additional or an increase or what is needed to help meet that need. Is that, Patricia, is that kind of what you were looking for?
Yes, thank you. I appreciate that. There is a question here, and I think this requires a lot of feedback, maybe from Beth and Vanessa or Nick, but it's a situation, so I'll just explain a little further. I would like to go back to the average of hours. My staff was in traffic for several hours due to road closure and detours. Another staff was overdue to doctor's appointments and travel time. How does the agency allow for coverages when incidents such as this occur, as we are told staff will not be paid? Now, please remember that our EVV and personal support is like an insurance. When you provide a service, you deliver. So what is personal support? What is that definition? Because transportation or being in traffic is not a service. So can we have a dialogue and have a discussion? Let's go ahead and start from the perspective of the provider, and then we'll go to Medicaid, Vanessa or Joey, and then hopefully that will answer everybody's questions. So Beth, let's start with you. How would you address that scenario?
Right. So I think I would raise the same question, Patricia, as you raised, as far as the goal of the service being transportation. And so then I would talk to the family also about the use of the services during the course of the month. So they have it, and it has been an adjustment for many families who are used to being able to provide services more fluidly across the PCP year. But if there is an additional need, as Nick has mentioned, we can go in and look and see for this time period, is there an additional need for hours? And that goes through the PCP process to make any changes or ask for any additional hours. But first I would start with the purpose and the goal of that service for that time period. And then I would look to see if there are other hours throughout the month that can be adjusted to meet the need of the person. And then if we find that this is a need on an ongoing basis, then I would look to the PCP team to say, this is something that needs to be addressed on an ongoing basis. And this is how many hours this is the number of hours that reflects the needs of that particular person.
Thank you, Beth. Joey or Vanessa, would you like to add anything to that?
I don't have too much to add. I think from our perspective on the ISS team, we are bound by what's in the PCP. So I think that question of is it an activity that meets the definition of personal supports is an important one. And that's something that providers would have to work with the DDA or the team for the participant to determine if additional hours are needed and make that PCP change to accommodate it. And as long as that is in the system, then we would be able to pay for the service.
Thank you, Joey. Nick, anything you want to add to that? Nope. Okay.
I don't think so, no.
All right. I'm hoping this is working for folks so you can see the perspective how the EVV works. That is a team effort with lots of the questions from our OHS office, the provider, and the DDA. And as we learn more information or concerns that you may have, or even things that you've actually have created that's making it work for you, we want to be able to share with families and the providers and everybody involved with this process. There are some questions in the chat box that I'm not really understanding. So I'm going to read it, but if you can clarify it, it would be really good. We still have about 15 minutes. And this is, again, is for you all to be able to share and discuss. And Marianne, you just tell me when you want me to stop reading any questions. But there is some questions about how much of the care provider time will EVV process take in clock in and clock out? And I'm not understanding the question, Ryan. So if you can clarify that, it would help a whole lot. Unless, Vanessa, you know what it means when I'm reading it, just as it's written on here. I know. So just take your time and type the question, Ron, and I'm happy to read it again for you. Okay, then the next one is, so a DDA provider DSP can call the EVV number and not use the fob. they can log in. They can log in individual MA number instead. Is that correct? Beth, you want to talk about that?
Yeah, sure. So, so the team has decided how the person will access the EVV system. And if they have a landline or a cell phone that they would like to use, then they don't need the key fob. They need only the information for that particular person, including their MA number. If the person doesn't have a landline or does not want the DSP to use their cell phone, then they can opt to use the OTP device. And then that is the way that the staff will access the system. But it's a personal preference. It's not a requirement one way or the other. And so that, again, goes back to the team. Excuse me. I think I have Vanessa's issue. I'm losing my voice today, too. Sorry about that.
Thanks, Beth. All right, so I got some clarification, and this requires a little discussion from everybody's perspective. This is a scenario, and it's people are asking that having a staff sign in and sign out and using an OTP device is taken away from the person. So instead of arriving immediately and focusing on the person, the PCP will have to do this whole process. And I want to know, how long does it take when a staff arrives to do the clocking in and clocking out? So can Vanessa or Joey, can you, or Beth, anybody, can explain what really is the time that it takes for a DSP to clock in, clock out, and how much does that takes away from the direct support of that person?
It takes about a minute.
Yes, I was going to say this. It doesn't take long.
Yeah, it takes about a minute to clock in.
Maybe two, depending. Sometimes you do have to dial the number more than once, but it doesn't take long. I don't see that would take away from anything.
Yeah.
Okay, thanks for that feedback. Beth?
Yeah, I think Alice, who is actually using the system, said it best. It takes about a minute, if maybe if you mess up one of the numbers by accident, or you have to call back and get through again. It is like anything new, it is an adjustment, it is a change. Our staff at our agency already have to come in the door and log into our payroll system to clock in and out. So there's time set aside, when they first get there. Maybe the person is used to the staff coming in and directly interacting with them as soon as they walk through the door, and this might be a change. So there might need to be something in place for the staff to kind of transition that time with the person who's used to them coming in and going directly to work with the person. And I'm sure that the staff and the family and the person can come up with some kind of system so it's understood when the staff comes in, this is a requirement, and it is a change, and it is an adjustment for everyone involved. So I understand your question, absolutely.
Yeah, I agree, because that's what I did. I talked to my individual, to the families, and explained the process. And I don't even think they noticed a little bit of time that it takes for me to do it. So I don't see it being a problem at all.
Yeah. Thank you for sharing your experience.
Mm-hmm.
There are some billing questions about LTSS and what shows in the system, and that some people shows that as DDA state funded, and so they want to know, how do they track the claims outside of LTSS? And if there are an LTSS and a state funded, you can still track it. I don't know, Nick, if you wanted to add anything to that, or do we need to, probably Mary Ann, we need to let Chioma and Valerie know that there's a lot of billing questions that we may want to have a specific webinar specific about billing itself, because I really want to focus on the EVV token devices and things like that. So not that I'm ignoring your question here, George, but I just want to make sure I really understand. And it's billing. So is it billing due to the OTP use, or is it billing specifically just in LTSS Maryland? And we can definitely put together a webinar for that and make sure that our team is aware.
I think that's a good idea, Patricia.
Okay. Any other? I'm looking to see if there's any more on the chat. Okay, I don't see any more questions in the chat here specifically to our EDV implementation or experience.
Okay.
So Beth, can you talk a little bit about what kind of training you had to provide to your staff in reference to making sure that they understand what their role is, and maybe what kind of training you have with the family or the participants?
Right. So we have a meeting every month. The case managers at Creative Options hold these meetings, one in the morning, one in the evening. So we used that time that was specifically set aside for those meetings to go over EVV and how it would be implemented at Creative Options. And they developed PowerPoint and allowed time for questions and answers. And we did that a couple different times. There was like an initial introduction, and then we had some more in-depth, step by step, this is how you use the system. They also distributed like a welcome packet, welcome to EVV, for all of the staff, and they had all of the information laid out for them, so that they could practice with the system. They could also, have it in front of them when they needed to use it, when they were ready to start. And then I know that we had a lot of one-on-one conversations with the staff. I had family members email me, and we had phone calls. So it was a process, but it was like I said, the initial introduction, and then the step-by-step guide. And we used information that was on the DDA website as part of our training. And then we had that follow-up. And then there's ongoing conversations that we're having as part of the training. So it wasn't just like a one and done kind of thing, like, here's the information, now you're good. It was, working through the kinks and anything that might have come up as they started to use the system. So we're still kind of in that phase of walking alongside the DSPs in order to ensure that it's implemented effectively.
Great, thank you, Beth, for that. That's really good news. I don't know, Joey or Vanessa, do you want to add any resources that you have available in addition to what Beth said for family and participants to go to learn more about the EVV system and how to use and how to train family and staff? I know, or on our DDA website, I know, Marianne, I'm going to turn it over to you because I think you have some things to share.
I sure do. Thank you, Patricia, and thank you to everyone who submitted questions, and of course to our panelists. This is a nice segue. I do have resources that I want to share with you, as Patricia just spoke about on our website. You'll find them, and I'm going to actually take you. If you go to the site on the homepage, the electronic visit verification, click on that, and it'll take you to this page. And here on the page, you'll find all of these different resources available to you and to provide you with the information you might need. Also, in order to receive any new updated information or any updates at all, you are welcome to join DDA's newsletter. To join our mailing list. And again, if you go to our homepage, you'll see join our mailing list right there. And just click on that and sign up to receive that for any new updates or information pertaining to EVV and anything else for that matter. With that, I want to thank you for joining us today. And in particular, I really want to thank our guests, Burton, Joseph Walburn, Vanessa Finc, Beth Eby, and Alice Adger for taking your time and sharing your experience with us. I also want to thank Patricia for monitoring these questions and making this possible. And of course, Bernie Simons, our Deputy Director, for making these webinars. I hope you'll join us for our next webinar on January 27th. The topic is still to be determined. And until then, I hope you'll take care and be well and have a great day.
Bye. Thank you. Bye-bye.
Bye-bye.
Thank you for having us.